Most of us tend to think that pain originates from the body and particularly from damage or harm in the body. In fact, it doesn't. Pain is always an output of the brain. And it's one of the most basic alarms that the brain uses to tell us that there's something wrong in order to get us to respond.
Imagine twisting your ankle. A signal travels up through the nervous system to the brain. The brain tries to work out what that signal means.
If what the signal is telling it is that there's a threat to the structure of the ankle, it will send pain down to the ankle as an alarm. It tells me there's something wrong, so it makes me pay attention, but it also stops me using it, which is actually what the body needs to repair the damage.
Acute pain is short-term pain. Pain that lasts about 3 months until the body's healed. But imagine a situation where your ankle is healed, but you are still in pain. Then we start talking about chronic pain.
If in 12 weeks, 13, 14, 15 weeks, it wasn't getting better, in other words, it was still painful, I would start to worry about what was going on. And that's where part of the problems that are all associated with long-term or chronic pain would start to begin.
Chronic pain is something quite different from acute pain, and it doesn't necessarily mean that there's still damage to your body, though we often think that there must be a problem somewhere.
It's very natural sort of behaviour, if you like, for people to then go and seek lots of investigations and tests and request referrals and scans and so on and so forth to try and identify this problem.
Some people spend years desperately seeking a solution.
When we can't make sense of things, we start to get distressed. And we know that stress and pain feed each other. So the more tense and stressed people are, usually their pain experience is much worse. There's lots of things we don't understand about pain, but that's one of the ones we're pretty sure about.
And so begins a vicious cycle.
Sleep gets disrupted. They often get side effects from drugs like constipation, dry mouth, fuzzy head, those kind of things. People find it very difficult to concentrate, and their short-term memory often gets affected, and we know that that's an effect of having chronic pain and the stress that comes with that as well.
Often people stop moving, stop exercising, and begin to find normal activity all rather difficult.
It's often a slow process that builds over time.
What most people want is to be able to explain to their friends and family why they're struggling so much. And a sound mixing desk is not a bad way of doing it. Imagine that this is your brain, and a load of signals are coming into it up your spinal cord, represented by all these wires.
And what the brain's trying to do is make sense of all the different inputs and really to create a coherent picture of what's going on in the world. And it's very like what the producer's trying to do, sitting behind a desk like this, where we have multiple channels of sound and different inputs coming in. And what he has to do is manipulate everything in order to create a coherent sound, or the whole track as we hear it.
So imagine you twist your ankle, and a signal is sent to the brain.
With acute pain, we would expect the signal that would be cueing the pain to come in and then to gradually fade away, so we wouldn't be too bothered about it. With chronic pain, something goes wrong. Even when we pull the slider down, we can't turn the sound off. So we would start to worry and get stressed about the fact that this terrible sound was coming through and somehow we couldn't switch it off.
3, 4, 5 months later, it's as if you twisted your ankle this morning. Call it acute or chronic, the pain's the same and it just won't stop. It's as if there's a storm raging in the brain. And if you think this is happening to you, a pain management programme could help.
A lot of the work that we do in pain management, particularly in the group-based pain management programmes, is all aimed at calming the storm.
In this series is a film about a pain clinic, including a pain management programme, where you can get support from specialists who understand pain and, of course, meet other people in the same situation. Ask your GP or consultant for a referral, and good luck.